My name is Julia Kaisla. I'm the Director of Community Engagement at the Canadian Mental Health Association BC Division. One of the things in my portfolio is I oversee all of our workplace initiatives. It's a role that is very engaging and changing all the time. We give presentations to multiple different kinds of organizations about why workplaces need to pay attention to mental health in the workplace. And we talk to senior leaders and we talk to frontline staff. And one of the reasons, we give them about three sort of groups of reasons about why they need to pay attention to this. And the first is the business case. So employers have been tracking drug costs for many years, and they've often seen significant increases in their costs related to cardiovascular drugs. And in recent years, they have seen sort of a leveling off of cardiovascular drug costs, but they've seen a significant increase in drugs related to mental illness. So quite often they're interested in focusing on this to bring those costs down. Another reason why they're focusing on this from a business cost perspective is because of the cost to recruit and train new employees. So if they aren't paying attention to workplace mental health and there's bullying and harassment or other issues taking place, people will often leave and they'll go somewhere else, and then they have to recruit a new employee, they need to train a new employee. So there's quite a lot of costs associated with that. Another reason that we give employers to pay attention to this is the legal costs. Employees in the workplace that are struggling with a mental illness, and a diagnosed mental illness is a disability, so they need to provide accommodation if upon request from the employee. So they need to understand how to navigate that request for accommodation. It's called duty to accommodate. And more employers are being asked to inquire if they're starting to see changes in behavior. So one of the emerging requirements for employers is the duty to inquire. And this is quite a good lever to start to train supervisors to identify signs that employees might be struggling with mental illness. Another reason within the legal framework about why employers need to pay attention is because in many provinces, in BC in particular, employers are required to have policies and procedures to prevent and address bullying and harassment. And so part of preventing bullying and harassment is creating a culture where bullying and harassment can't take root. So more and more employers are looking to us and to other experts to determine how to make changes in their work environment to create a more supportive workplace so that employees aren't negatively harmed by the work environment. The third big category about why employers need to pay attention to mental health in the workplace is the social component, and quite often this relates to reputation. So as I mentioned earlier, if employers have a negative work environment, if morale is low, if there are lots of health and safety concerns, if it's a toxic work environment, then it does affect their reputation. And when their reputation is negatively affected, then perhaps employees don't want to work for them. But another reason is that they could be a media issue with their workplace. And we have seen multiple organizations in the last little while where they have had very negative reviews about their work environment, and that definitely impacts stakeholders and shareholders in particular who don't want to see this kind of media portrayal of an organization they're invested in. Another reason why employers are paying attention is because it's the right thing to do. I think we all recognize that mental illness affects so many people in our population. It affects pretty much every single person in Canada in some way. And that might be because they themselves have experienced a mental illness, and it could be because someone close to them, a family member, for example, has experienced a mental illness. And so there is a sense that this is something we as a country need to wrestle with. It's something that we as a larger community need to figure out how to address and support people that are experiencing mental illness so they can come back to living a productive life where they're contributing in a positive way to their workplaces, their families, and their communities. So in terms of what workplaces can do to address workplace mental health and improve workplace mental health, another term that we have all become more familiar with is psychological health and safety in the workplace. And in 2013, Canada came up with the world's first national standard on psychological health and safety in the workplace. And since then, many organizations have looked to this standard as a bit of a roadmap about how they can look at their organization in a more systematic way and assess it for psychological health and safety and make improvements. And so I don't know how many organizations feel that they've come to the end of the road with implementation of the standard. It is a bit more of a journey than a destination kind of roadmap. So it is another tool that workplaces can use for assessment and implementation. And more, the Canadian Mental Health Association, the Mental Health Commission of Canada, and multiple other organizations are helping to create tools that organizations can use to move forward in this journey. Another way that the Canadian Mental Health Association has helped with organizations who want to address this differently is by starting to break down the stigma around mental illness. And we do this in many ways. The Canadian Mental Health Association really believes that we can learn something from listening to people's stories. We can hear from them what helped them and what would have helped them. So since 2001, the Canadian Mental Health Association has had a conference in Canada called the Bottom Line Conference. It's about workplace mental health. And we invite speakers to tell their stories. And we have a discussion. We have a big discussion. We have representatives from the human resources sector, occupational health and safety, labor, government, private industry, the not-for-profit sector, and we start to have these conversations about what do we want to see change and how can we all make change together. And so since then, our conference is now in its 13th year. We had a couple of skipped years in between. And we are starting to see more and more people come to the conference because they want to be part of the solution. And something that we've done as a follow-up to this conference is we've invited individuals to tell their personal stories as part of a presentation that we host within workplaces. And it's amazing to me that I go in quite often with these individuals and I deliver the presentations in different work environments, from remote settings in the Northwest Territories to business environments here in the Lower Mainland, in Vancouver. And when somebody sits in front of you and tells you their personal story of mental illness, it makes you think about what you can do differently, because you feel a sense of compassion and empathy for that experience, and you want to do better. And you want to see how you can change your behavior to be more supportive. And that have proven to be very, very successful in getting people to be more reflective about their behaviors and the assumptions they're making about people in the workplace. So I think this has been a very useful tool. I think it's something that we can help facilitate, but it's something that workplaces can also do themselves. They can help identify champions within the work environment who are willing to come forward and tell their story and be part of the solution, and empower them to tell their stories openly and give them a platform to do so. So that's something that we're really helping to grow, and we're hoping grows way beyond what the Canadian Mental Health Association is able to do. So quite often when we do invite people, or when we're invited in to have someone tell their story, or an organization has empowered someone to tell their personal story, it comes with a lot of risk, because organizations aren't always well equipped to create a supportive environment, even for that one individual who's come forward and told their story. So what do we do to help organizations move past that step? One of the things that we do, that we recommend, is we do training for supervisors. And I think one of the big gaps in workplaces across the country is that managers and supervisors don't have the skills to respond in a supportive way to individuals who might be struggling. And also, workplaces are not doing a very good job of considering the resources that they have in place to support individuals who might be struggling. So yes, quite often they do have a benefits plan. And yes, they do have an employee assistance program, but quite often those tools aren't being used, and it's because there's still a lot of misunderstanding or lack of information about those tools. So when we go in and we do training for supervisors and managers, we say, well, you need to tell your employees that these tools are available, and more than that, you need to phone those helplines, and you need to try them out and feel what it feels like to use that service. You need to understand that they are, in almost every case, confidential, and that information will not be shared with the employer. You need to understand the process, that it is usually a telephone or in-person coaching session or counseling session. You need to help to break down those barriers of fear for the individuals. So workplaces, I think they need to do a lot more education for employees around what are the benefits that you have in place. They also need to do some reflection about whether those programs and services are actually meeting the needs of the employees. So I know employees, they often ask for, massage as part of their benefits plan, and they might not be asking for psychological services as part of their benefits plan because they don't want to be the first person to raise their hand. But if you're starting to see that mental illness drugs are substantial in terms of the drug costs that your organization is experiencing, maybe you should start asking and start offering additional psychological services as part of your benefits plan so that employees who do have a serious mental illness that might not be resolved by 5 visits to an employee assistance plan can access psychological services in the community and choose their own psychologist. So sometimes it's just education, and I think employers, they want to do the right thing, supervisors and managers want to do the right thing, co-workers, they want to support one another. Sometimes they don't have the skills to have the conversations, sometimes they don't know what questions to ask, and sometimes they don't know what steps to take. And by opening up the dialogue and asking some of those difficult questions, I think we all get to a better place.